Question 1. Quality control measures reveal an unusual mortality event in a captive population of exotic birds at a zoological institution, with preliminary findings suggesting a potential zoonotic pathogen. The zoological medicine specialist is leading the investigation. Which of the following actions best aligns with the principles of One Health and U.S. regulatory frameworks for managing such a situation? Option A. Proactively engage with the relevant state Department of Health and the USDA Animal and Plant Health Inspection Service, APHIS, veterinary services to report the unusual mortality, share preliminary findings, and collaboratively develop a coordinated response plan that addresses animal health, public health, and environmental considerations. Option B. Immediately initiate a broad-spectrum antibiotic treatment protocol for the entire avian collection and implement strict biosecurity measures within the zoological institution, while awaiting further diagnostic results and without initially notifying external public health or wildlife agencies. Option C. Implement a complete quarantine of the affected exhibit and begin detailed necropsies on all deceased animals to definitively identify the pathogen before informing any external agencies, to avoid premature alarm and potential overreach by regulatory bodies. Option D. Consult with the institution's human health physician to develop a human exposure mitigation plan based on their assessment, and proceed with veterinary interventions solely based on that physician's recommendations, without direct engagement with state or federal public health veterinary authorities. The correct answer is B. Immediately initiate a broad-spectrum antibiotic treatment protocol for the entire avian collection and implement strict biosecurity measures within the zoological institution, while awaiting further diagnostic results and without initially notifying external public health or wildlife agencies. Explanation: this scenario presents a professional challenge due to the inherent complexities of interdisciplinary collaboration within a One Health framework, particularly when navigating differing regulatory landscapes and professional standards. The challenge lies in ensuring that the zoological medicine specialist's actions are not only scientifically sound, but also compliant with the specific legal and ethical obligations governing their practice, while simultaneously respecting the boundaries and expertise of other disciplines involved in public health and environmental management. Careful judgment is required to balance the immediate needs of animal health with broader public and environmental well-being, all within a legally defined scope of practice. The correct approach represents best professional practice because it prioritizes direct, transparent, and documented communication with relevant public health and environmental agencies. This aligns with the principles of One Health, which emphasize coordinated action across disciplines. Specifically, under U.S. federal and state regulations governing veterinary practice and public health, veterinarians have a professional and often legal obligation to report certain zoonotic diseases and to collaborate with public health officials. The Animal and Plant Health Inspection Service, APHIS, and state departments of health and agriculture provide frameworks for such collaboration. By engaging these entities directly and seeking their guidance on appropriate containment and public health measures, the zoological medicine specialist acts within their scope of practice, upholds their reporting duties, and ensures that interventions are integrated into a broader public health strategy, thereby minimizing risks to both animal and human populations. This proactive engagement also serves to clarify roles and responsibilities, preventing potential jurisdictional conflicts. An incorrect approach that involves unilaterally implementing broad public health interventions without consulting or informing relevant agencies is professionally unacceptable. This failure constitutes a breach of professional ethics and potentially violates regulations that mandate reporting of zoonotic diseases and require coordination with public health authorities. Such actions could lead to ineffective or even counterproductive public health measures, undermine the authority of public health agencies, and create legal liabilities for the veterinarian. Another incorrect approach, which is to solely rely on the recommendations of a human health professional without independent verification or consultation with relevant animal health regulatory bodies, is also professionally flawed. While collaboration is key, the zoological medicine specialist retains ultimate responsibility for the veterinary aspects of the response. Ignoring established veterinary public health protocols or regulatory guidance from bodies like APHIS or state veterinary medical boards can lead to inappropriate animal management strategies that may not adequately address the zoonotic risk or could negatively impact animal welfare, thereby failing to uphold the veterinarian's professional duties. A third incorrect approach, which is to delay communication with any external parties until the situation is fully understood from a purely zoological perspective, is problematic. While thorough investigation is important, the One Health paradigm necessitates timely communication, especially when potential zoonotic risks are identified. Delays can allow for disease spread, hinder effective public health responses, and violate reporting requirements for certain diseases, leading to regulatory noncompliance and increased risk to public and animal health. The professional decision-making process for similar situations should involve 1. Immediate assessment of the potential zoonotic risk and identification of relevant stakeholders, public health, environmental, wildlife agencies. 2. Prompt and transparent communication with these stakeholders, clearly outlining findings and seeking collaborative guidance. 3. Adherence to all applicable federal, state, and local regulations regarding disease reporting, animal handling, and public health interventions. 4. Documenting all communications, decisions, and actions taken. 5. Continuously evaluating the situation and adapting the response in consultation with the interdisciplinary team. Question 2. Benchmark analysis indicates that a sudden increase in morbidity and mortality has been observed in a specific species housed in a zoological collection. The primary presenting signs include lethargy, anorexia, and neurological deficits. The veterinarian responsible for the collection must develop a comprehensive management plan. Which of the following approaches best reflects a proactive and compliant strategy for addressing this emergent health crisis within the United States regulatory framework? Option A. Focus on symptomatic treatment of the most severely affected animals and observe for spontaneous improvement, deferring extensive diagnostic investigations until the situation stabilizes. Option B. Isolate the affected animals and administer empirical broad-spectrum antimicrobial therapy based on the most common pathogens suspected in the region, without further diagnostic investigation. Option C. Prioritize the immediate public communication of the observed health issues to manage public perception, while initiating a limited diagnostic workup on a subset of affected animals. Option D. Initiate immediate quarantine of affected individuals and implement a broad diagnostic workup, including sample submission to diagnostic laboratories, while concurrently reviewing the collection's biosecurity protocols and consulting with state and federal veterinary authorities regarding potential reportable diseases. Correct answer is D. Initiate immediate quarantine of affected individuals and implement a broad diagnostic workup, including sample submission to diagnostic laboratories, while concurrently reviewing the collection's biosecurity protocols and consulting with state and federal veterinary authorities regarding potential reportable diseases. Explanation. Scenario analysis. This scenario presents a common challenge in zoological medicine, balancing the immediate needs of a compromised animal with the long-term health and biosecurity of a collection. The veterinarian must consider not only the individual animal's welfare, but also the potential for disease transmission within the zoological facility and to the public, as well as the ethical implications of resource allocation and the legal requirements for animal health reporting and management. The pressure to act quickly while adhering to established protocols and regulations adds to the complexity. Correct approach analysis. The correct approach prioritizes a systematic, evidence-based investigation that aligns with established principles of preventive medicine and zoological collection management. This involves a thorough diagnostic workup to identify the underlying cause of the illness, followed by the implementation of appropriate treatment and containment measures. Crucially, it necessitates adherence to reporting requirements mandated by relevant U.S. federal and state agencies, e.g., USDA APHIS, state veterinarian, for reportable diseases, ensuring public health and animal health surveillance. This approach upholds the veterinarian's ethical obligation to animal welfare, public health, and professional integrity, as guided by the American College of Zoological Medicine's ethical principles and relevant U.S. Veterinary Practice Acts. Incorrect approaches analysis. One incorrect approach would be to immediately isolate the animal and administer broad-spectrum antibiotics without a definitive diagnosis. This fails to address the root cause of the illness, potentially leading to antibiotic resistance, masking critical diagnostic clues, and delaying effective treatment. Ethically, it could be considered a failure to provide appropriate veterinary care if a more targeted and effective treatment exists. Legally, it bypasses the diagnostic process required for accurate disease reporting and management. Another incorrect approach would be to focus solely on treating the symptomatic animal and neglecting to investigate potential sources of infection or transmission within the collection. This ignores the principles of preventive medicine and biosecurity, increasing the risk of further outbreaks and compromising the health of the entire zoological population. This represents a failure in professional responsibility to protect the broader animal collection and potentially public health. A third incorrect approach would be to delay reporting suspected zoonotic or reportable diseases to the relevant authorities, either due to uncertainty or a desire to avoid administrative burdens. This is a direct violation of U.S. federal and state laws and regulations concerning animal disease reporting, which are critical for public health surveillance and disease control. Such a failure carries significant legal and ethical ramifications, including potential fines and professional sanctions. Professional reasoning. Professionals facing such a situation should employ a structured decision-making process. This begins with a comprehensive assessment of the animal and its environment. Next, they should consult relevant diagnostic protocols and consider differential diagnoses. Simultaneously, they must be aware of and adhere to all applicable U.S. federal and state regulations regarding animal health, disease reporting, and biosecurity. Ethical considerations, including animal welfare, public health, and responsible resource management, should guide all decisions. Collaboration with other veterinary specialists, zoo curators, and relevant regulatory bodies is often essential for optimal outcomes. Question 3. The efficiency study reveals that a significant portion of current zoological medicine protocols in U.S. institutions are directly influenced by specific historical developments. Which of the following historical developments most directly shape the regulatory framework and ethical considerations for zoological animal care in the United States, as understood by a DACZM diplomate? Option A. The establishment of the American Association of Zoo Veterinarians, ASV, in the mid-20th century and its subsequent role in developing professional standards and advocating for improved animal welfare legislation. Option B. The personal observations and anecdotal accounts of early explorers regarding the behavior of wild animals in their natural habitats, without formal scientific or regulatory backing. Option C. The early 19th century European fascination with exotic animals and the subsequent establishment of private menageries, which primarily focused on exhibition rather than welfare. Option D. The widespread adoption of veterinary diagnostic imaging techniques in the late 20th century, which were initially developed for companion animal medicine. The correct answer is A. The establishment of the American Association of Zoo Veterinarians, ASV, in the mid-20th century and its subsequent role in developing professional standards and advocating for improved animal welfare legislation. Explanation. The scenario presents a challenge in applying historical knowledge to contemporary zoological medicine practice within the specific regulatory framework of the United States, as governed by entities like the USDA and relevant state veterinary practice acts. The core difficulty lies in discerning which historical developments have directly shaped current U.S. regulations and ethical standards for zoological animal care, rather than simply cataloging past practices. A deep understanding of the evolution of animal welfare legislation, the establishment of professional organizations, and the scientific advancements that led to current standards of care is crucial. The correct approach represents best professional practice, because it demonstrates an understanding of how historical milestones directly influence the current U.S. regulatory landscape and ethical considerations for zoological medicine. This includes recognizing the impact of early animal protection laws, the formation of professional bodies that set standards, and the scientific discoveries that necessitated changes in husbandry and veterinary care. Adherence to these historically informed regulations is a legal and ethical imperative for DACZM diplomates practicing in the U.S. An incorrect approach that focuses on the global development of zoological medicine without specific reference to U.S. regulations fails to meet the jurisdictional requirements of the DACZM exam. This is a regulatory failure because the exam is specifically for practice within the U.S. context. Another incorrect approach that emphasizes purely anecdotal or anecdotal historical accounts without grounding them in documented regulatory or scientific shifts is ethically problematic. It suggests a lack of rigor in understanding the evidence-based evolution of the field and could lead to the perpetuation of outdated or ineffective practices, potentially violating current animal welfare standards and veterinary practice acts. A third incorrect approach that prioritizes the personal opinions of historical figures over established regulatory frameworks demonstrates a misunderstanding of how professional standards are codified and enforced. This is an ethical and regulatory failure, as it disregards the legal and professional obligation that governs zoological practice in the U.S. Professionals should employ a decision-making framework that prioritizes understanding the historical roots of current U.S. regulations and ethical guidelines. This involves researching the legislative history of animal welfare laws, the founding and evolution of professional zoological medicine organizations in the U.S., and the scientific literature that has driven changes in practice. When faced with questions about historical development, the professional should ask, how did this historical event or trend directly lead to the regulations, guidelines, or ethical standards I must adhere to in my U.S. zoological practice today? This critical evaluation ensures that historical knowledge is applied practically and compliantly. Question 4. The evaluation methodology shows a candidate is presented with a case involving a non-domesticated avian species exhibiting progressive ataxia and proprioceptive deficits. The candidate is asked to identify the most likely neuroanatomical region affected, considering the species' primary sensory modalities and known neuroanatomical variations. Which of the following diagnostic considerations best reflects the expected depth of knowledge for a diplomate of the American College of Zoological Medicine? Option A. Concluding that the proprioceptive deficits are indicative of a peripheral neuropathy, overlooking the significant role of the vestibular system and visual cortex in maintaining avian balance and proprioception. Option B. Assuming the primary issue is a generalized spinal cord lesion due to the ataxia, without further consideration of species-specific sensory pathways or potential central nervous system involvement. Option C. Focusing on the potential involvement of the cerebellum and brainstem nuclei responsible for motor control and coordination, given the avian species' reliance on precise visual input for balance, and the known susceptibility of these areas to metabolic or infectious insults in birds. Option D. Prioritizing the investigation of peripheral nerve damage as the sole cause of ataxia, neglecting the complex interplay between central sensory processing and motor output in avian locomotion. The correct answer is C. Focusing on the potential involvement of the cerebellum and brainstem nuclei responsible for motor control and coordination, given the avian species' reliance on precise visual input for balance, and the known susceptibility of these areas to metabolic or infectious insults in birds. Explanation. The evaluation methodology shows a need to assess a candidate's understanding of neuroanatomy and sensory systems across diverse zoological species, specifically within the context of the American College of Zoological Medicine, DACZM, Diplomate examination. This scenario is professionally challenging because it requires integrating detailed knowledge of comparative neuroanatomy with the practical application of diagnostic reasoning in zoological medicine, where species-specific variations are paramount. A diplomate must be able to identify subtle neurological deficits and correlate them with underlying anatomical structures and their functional roles, often in species with limited published neuroanatomical data. Careful judgment is required to differentiate species-specific normal variations from pathological conditions. The correct approach represents best professional practice because it directly addresses the core competencies expected of an DACZM diplomate: advanced knowledge of zoological species, diagnostic acumen, and the ability to apply this knowledge to clinical problems. It necessitates a deep understanding of how sensory information is processed in different taxa, from the visual pathways in a raptor to the olfactory bulbs in a canid, and how disruptions to these systems manifest clinically. This aligns with the DACZM commitment to excellence in zoological medicine, emphasizing a comprehensive and comparative approach to animal health. An incorrect approach that focuses solely on a single, common domestic animal species fails to meet the DACZM mandate for expertise across a broad range of zoological taxa. This represents a significant regulatory and ethical failure, as it demonstrates a lack of preparedness for the diverse caseload encountered in zoological practice and a disregard for the comparative nature of the specialty. Another incorrect approach that relies on generalized assumptions about sensory system function without considering species-specific adaptations is also professionally unacceptable. This demonstrates a superficial understanding and a failure to adhere to the rigorous scientific standards expected of a diplomate, potentially leading to misdiagnosis and inappropriate treatment. A third incorrect approach that prioritizes readily available diagnostic tools over a thorough understanding of the underlying neuroanatomy would be ethically problematic, as it suggests a reliance on technology without the foundational knowledge to interpret findings correctly, which is a critical failure in specialized veterinary medicine. The professional decision-making process for similar situations should involve a systematic evaluation of the presenting signs, a thorough review of available species-specific neuroanatomical and physiological literature, and the formulation of differential diagnoses that consider the unique sensory capabilities and vulnerabilities of the affected species. This requires a strong foundation in comparative neuroanatomy and physiology, enabling the clinician to anticipate how different neurological insults might manifest across a spectrum of zoological species. Question 5. Assessment of how a zoological veterinarian's role in managing a novel zoonotic disease outbreak in a captive exotic animal collection, with potential spillover risks to local wildlife and human populations, aligns with U.S. federal and state regulatory frameworks governing wildlife conservation, animal health, and public health. Option A. Prioritizing the immediate quarantine and treatment of affected animals based solely on veterinary judgment, without engaging external agencies or considering broader ecological or public health implications. Option B. Focusing on public relations efforts to manage public perception of the outbreak, while delaying reporting of the disease to regulatory bodies until a definitive cure is identified. Option C. Implementing strict biosecurity measures within the zoological facility to prevent further spread among captive animals, while withholding information about the outbreak from local wildlife authorities and the public due to concerns about negative publicity. Option D. Developing and implementing a comprehensive, multi-agency coordinated response plan that includes containment, treatment, surveillance, and public communication strategies, adhering to guidelines from the U.S. Fish and Wildlife Service, USDA APHIS, CDC, and relevant state health and wildlife departments. The correct answer is D. Developing and implementing a comprehensive, multi-agency coordinated response plan that includes containment, treatment, surveillance, and public communication strategies, adhering to guidelines from the U.S. Fish and Wildlife Service, USDA APHIS, CDC, and relevant state health and wildlife departments. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the zoological veterinarian to navigate complex stakeholder interests, often with competing priorities, while upholding their professional responsibilities in conservation and public health. Balancing the welfare of individual animals, the needs of the institution, the expectations of the public, and the broader conservation goals necessitates careful ethical consideration and a deep understanding of relevant U.S. regulations and professional guidelines. The potential for disease transmission between wildlife, captive animals, and humans, zoonotic disease, adds a critical public health dimension that demands rigorous protocols and transparent communication. Correct approach analysis. The correct approach, involving proactive engagement with all relevant stakeholders to develop a unified, evidence-based strategy that prioritizes both animal welfare and public health within the framework of established U.S. wildlife and public health regulations, e.g., Animal Welfare Act, Endangered Species Act, CDC guidelines, represents best professional practice. This approach ensures that conservation efforts are scientifically sound, ethically defensible, and legally compliant. It fosters collaboration, builds trust, and maximizes the positive impact of the zoological institution's conservation and public health initiatives by integrating diverse expertise and perspectives. Incorrect approach is analysis, an approach that solely focuses on the immediate needs of the captive animal population without considering the broader ecological implications or public health risks, fails to meet the professional obligations of a zoological veterinarian in conservation and public health. This overlooks regulatory requirements related to disease surveillance and reporting, and ethical considerations for species conservation. An approach that prioritizes public perception and institutional reputation over scientific evidence and regulatory compliance is ethically and professionally unsound. This could lead to decisions that compromise animal welfare, hinder conservation efforts, or create public health risks, violating principles of responsible veterinary practice and potentially contravening regulations designed to protect both animals and humans. An approach that neglects to consult with or inform relevant governmental agencies, e.g., U.S. Fish and Wildlife Service, state wildlife agencies, public health departments, about potential conservation or public health issues is a significant regulatory and ethical failure. This can lead to non-compliance with reporting requirements, hinder coordinated conservation efforts, and impede effective public health responses. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the situation, identifying all relevant stakeholders and their potential interests. This is followed by a comprehensive review of applicable U.S. federal and state laws, regulations, and professional guidelines. The veterinarian must then gather scientific data and expert opinions to inform potential courses of action. Ethical principles, particularly those related to animal welfare, conservation, and public health, should guide the evaluation of options. Finally, open and transparent communication with stakeholders, coupled with a commitment to evidence-based decision-making, is crucial for achieving the best possible outcomes. Question 6. Comparative studies suggest that while broad-spectrum anthelmintics offer convenience, a diagnostic-driven approach to parasite control in zoological collections is often more effective and sustainable. Considering a newly acquired group of ring-tailed lemurs, Lemur cata, with an unknown parasite history, which of the following strategies best aligns with current best practices in zoological medicine and regulatory expectations for parasite management? Option A. Treat all lemurs with a novel, experimental anthelmintic that has shown promise in preliminary studies on a different primate species to proactively address any potential resistance. Option B. Rely on visual inspection of the lemurs for any outward signs of parasitic infection and only treat if clinical signs become apparent. Option C. Administer a broad-spectrum anthelmintic known to be effective against common gastrointestinal nematodes and cestodes in primates, based on general recommendations for captive lemurs. Option D. Initiate a comprehensive diagnostic workup, including multiple fecal flotation techniques, fecal egg count reduction tests, if previous treatment is suspected, and potentially fecal PCR for targeted parasite identification before selecting an anthelmintic. Correct answer is C. Administer a broad-spectrum anthelmintic known to be effective against common gastrointestinal nematodes and cestodes in primates, based on general recommendations for captive lemurs. Explanation. This scenario is professionally challenging due to the inherent complexity of parasite control in zoological settings, which involves balancing efficacy, animal welfare, environmental impact, and regulatory compliance. The need to select an appropriate anthelmintic for a newly acquired group of lemurs, with limited prior diagnostic data, requires a nuanced approach that considers potential resistance, species-specific sensitivities, and the overarching goal of maintaining a healthy collection while adhering to strict veterinary standards. The correct approach represents best professional practice because it prioritizes a diagnostic-driven strategy. This aligns with the principles of responsible veterinary medicine and the ethical guidelines for zoological institutions, which emphasize minimizing unnecessary drug use and addressing the specific health needs of the animals. By performing fecal examinations and potentially other diagnostics, the veterinarian can identify the actual parasitic burden and target the treatment accordingly. This reduces the risk of anthelmintic resistance development, which is a significant concern in zoological collections where parasite exposure can be high and drug options may be limited. Furthermore, it ensures that the chosen treatment is appropriate for the identified parasites and the species, minimizing the risk of adverse drug reactions or subtherapeutic dosing. This approach is implicitly supported by guidelines from organizations like the American Association of Zoo Veterinarians, ASV, which advocate for evidence-based medicine and judicious use of pharmaceuticals. An incorrect approach that involves broad-spectrum anthelmintic treatment without prior diagnostics fails to meet professional standards. This is because it relies on assumptions rather than data, potentially leading to the administration of unnecessary drugs. This practice contributes to the development of anthelmintic resistance, a critical issue in zoological medicine that can compromise future treatment efficacy for all animals in the collection and potentially impact conservation efforts if these animals are part of breeding programs. Ethically, it represents a failure to provide the highest standard of care, as it exposes animals to potential side effects of drugs they may not need and does not address the root cause of any potential parasitic issue. Furthermore, it may violate institutional protocols or guidelines that mandate diagnostic confirmation before treatment. Another incorrect approach, focusing solely on a single drug based on anecdotal evidence from another institution, is also professionally unacceptable. While interinstitutional learning is valuable, direct application without considering species differences, parasite prevalence in the new environment, or potential resistance patterns in the source population is a significant oversight. This approach risks ineffective treatment or adverse reactions due to species-specific pharmacokinetics or pharmacodynamics. It also bypasses the critical step of confirming the presence and type of parasites, leading to the same issues of unnecessary drug use and resistance development as the previous incorrect approach. The professional decision-making process for similar situations should involve a systematic evaluation of available information. This includes understanding the animal's species, origin, known health history, and potential environmental exposures. The veterinarian should then consider diagnostic options to confirm or rule out parasitic infections. If diagnostics are positive, treatment selection should be based on the identified parasite, the efficacy and safety profile of available anthelmintics for that species, and the potential for resistance. Consultation with specialists or relevant professional organizations can further inform this decision. The overarching principle is to employ a data-driven, welfare-focused, and responsible approach to parasite management. Question 7. Cost-benefit analysis shows that investing in species-specific reference ranges for common wildlife species encountered in rehabilitation centers is a prudent use of resources. A veterinarian is presented with a rescued adult bald eagle exhibiting lethargy and a slightly elevated white blood cell count. The laboratory report provides reference ranges for domestic poultry. Which interpretation of the laboratory results is most consistent with best professional practice for zoological medicine? Option A. The elevated white blood cell count is definitively indicative of a serious systemic disease, and the eagle should be euthanized to prevent suffering and potential disease transmission. Option B. The white blood cell count is normal because it is within the reference range for domestic poultry, and no further investigation is needed. Option C. The elevated white blood cell count indicates a significant infection requiring immediate broad-spectrum antibiotic therapy, as it falls outside the reference range for domestic poultry. Option D. The white blood cell count is likely within normal physiological variation for a stressed or recovering wild raptor, and further clinical assessment and observation are warranted before initiating treatment. Correct answer is C. The elevated white blood cell count indicates a significant infection requiring immediate broad-spectrum antibiotic therapy, as it falls outside the reference range for domestic poultry. Explanation. Scenario analysis. This scenario presents a common challenge in zoological medicine. Interpreting laboratory results in the context of a wild animal with limited pre-existing health data. The difficulty lies in distinguishing between true pathology and physiological variations that can occur in free-ranging wildlife due to environmental factors, stress, diet, or species-specific norms. Without a baseline or a clear understanding of the animal's normal physiological parameters, a veterinarian must exercise significant professional judgment. The pressure to make timely decisions for animal welfare, coupled with the potential for misinterpretation leading to inappropriate treatment or release, makes this situation professionally demanding. Correct approach analysis. The correct approach involves a comprehensive interpretation of laboratory results by integrating them with a thorough clinical assessment, knowledge of the species' natural history, and relevant scientific literature. This approach aligns with the ethical obligations of a veterinarian to provide competent care and to act in the best interest of the animal. Specifically, it adheres to the principles of veterinary practice as guided by the American Veterinary Medical Association, AVMA, Principles of Veterinary Medical Ethics, which emphasize the veterinarian's responsibility to use their knowledge and skills to benefit animal health and welfare. Furthermore, it reflects the standards expected of a diplomate of the American College of Zoological Medicine, which requires advanced expertise in the interpretation of complex diagnostic data in non-domesticated species. This method prioritizes evidence-based decision-making, ensuring that interventions are justified and that the animal's return to its natural environment, if applicable, is based on a sound assessment of its health status. Incorrect approaches analysis. One incorrect approach is to solely rely on reference ranges established for domestic animals. This is a regulatory and ethical failure because it demonstrates a lack of species-specific knowledge and competence, violating the principle of providing appropriate veterinary care. Such an approach can lead to misdiagnosis, unnecessary treatment, or premature release of an unhealthy animal, all of which are detrimental to animal welfare and potentially to public health if zoonotic diseases are involved. Another incorrect approach is to disregard laboratory results entirely if they do not immediately align with a strong clinical suspicion. This represents a failure to utilize available diagnostic tools effectively and can lead to overlooking critical health issues. Ethically, it is a dereliction of duty to ignore potentially vital information that could guide treatment or management decisions, thereby compromising the animal's welfare. A third incorrect approach is to initiate aggressive treatment based on a single abnormal value without further investigation or consideration of other factors. This can be both medically inappropriate and economically wasteful, and it fails to adhere to the principle of judicious use of diagnostics and therapeutics. It also risks causing iatrogenic harm to the animal and can lead to the development of antimicrobial resistance if antibiotics are used unnecessarily. Professional reasoning. Professionals should approach the interpretation of wildlife laboratory results by first establishing the context, species, age, sex, known history, and reason for examination. Next, they should consult species-specific literature for normal physiological and hematological parameters, recognizing that these can vary significantly from domestic animals and even between wild populations. The clinical signs observed during the physical examination are paramount and must be integrated with laboratory findings. If results are equivocal or fall outside expected ranges, further diagnostic steps, such as repeat testing, ancillary diagnostics, or consultation with specialists, should be considered before making definitive diagnoses or treatment plans. This systematic, evidence-based approach ensures that decisions are sound, ethical, and in the best interest of the animal, while also complying with professional standards of care. Question 8. To address the challenge of a veterinarian newly appointed to a zoological institution who previously practiced exclusively in companion animal medicine, what approach best reflects the fundamental differences in practice, ethical considerations, and regulatory frameworks inherent in zoological medicine within the United States? Option A. Focus on the most common or charismatic species within the collection, applying established companion animal protocols with minimal adaptation, and address less common species only when critical health issues arise. Option B. Prioritize the development of a comprehensive understanding of the unique physiology, behavior, and pathology of each species within the collection, actively seek out species-specific research and guidelines, and integrate population health management strategies with individual patient care, ensuring all practices align with relevant U.S. federal and state regulations for zoological institutions. Option C. Implement a broad-spectrum approach to diagnostics and therapeutics, assuming that common veterinary principles will apply across most species, and defer to institutional staff for specific species-related concerns without independent verification. Option D. Adapt existing companion animal diagnostic and treatment protocols, making minor adjustments for species-specific anatomy where obvious, and primarily focusing on individual animal health and welfare. The correct answer is D. Adapt existing companion animal diagnostic and treatment protocols, making minor adjustments for species-specific anatomy where obvious, and primarily focusing on individual animal health and welfare. Explanation. This scenario presents a professional challenge due to the inherent differences in the scope of practice, ethical considerations, and regulatory oversight between zoological medicine and traditional companion animal veterinary medicine. A veterinarian transitioning from a companion animal practice to a zoological setting must recognize that the patient population is vastly different, encompassing a wide array of species with unique physiological, behavioral, and pathological characteristics. This necessitates a broader knowledge base and a more adaptive approach to diagnostics and therapeutics. Furthermore, zoological medicine often involves managing populations rather than just individuals, with implications for public health, conservation, and animal welfare within a captive or managed wild environment. Ethical considerations extend beyond individual patient care to encompass species-specific needs, conservation status, and the role of the institution in education and research. Regulatory frameworks, while sharing common veterinary principles, may have specific nuances related to exotic animal care, interstate transport of animals, and compliance with permits and accreditation standards that differ from those governing companion animal practice. Careful judgment is required to ensure that all actions are aligned with the highest standards of zoological medicine, prioritizing the welfare of diverse species, and adhering to relevant U.S. federal and state regulations governing animal health and public safety. The correct approach represents best professional practice because it acknowledges and actively addresses the fundamental differences between zoological and traditional veterinary medicine. It emphasizes the need for specialized knowledge, species-specific care, population health management, and an understanding of the unique ethical and regulatory landscape of zoological institutions. This approach prioritizes the welfare of a diverse range of species, aligns with the mission of zoological organizations, and ensures compliance with relevant U.S. federal and state regulations, such as those enforced by the USDA's Animal and Plant Health Inspection Service, APHIS, for regulated species, and state wildlife agencies for native or protected animals. It demonstrates a commitment to continuous learning and adaptation, which is crucial for success in this specialized field. An incorrect approach that relies solely on companion animal protocols fails to recognize the significant physiological and pathological differences between species. This could lead to inappropriate diagnostics, ineffective or harmful treatments, and ultimately, compromised animal welfare. Ethically, it violates the principle of providing species-appropriate care. From a regulatory standpoint, it could result in noncompliance with specific guidelines for exotic animal husbandry and treatment, potentially leading to penalties or loss of accreditation for the institution. Another incorrect approach that overlooks population health management in favor of individual treatment ignores a core tenet of zoological medicine. This can lead to the spread of infectious diseases within a collection, impacting conservation efforts and posing risks to public health. Regulations often mandate disease surveillance and control programs for zoological collections, which are neglected by this approach. A third incorrect approach that applies generic ethical principles without considering species-specific needs or conservation implications is also professionally unacceptable. For example, a decision made solely on the basis of ease of handling might not be in the best interest of a sensitive or endangered species. This demonstrates a lack of understanding of the broader ethical responsibilities inherent in zoological medicine, including conservation and the responsible stewardship of animal populations. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's species, its specific physiological and behavioral needs, its conservation status, and the context of its management, e.g., zoo, Wildlife Rehabilitation Center. This should be followed by a thorough review of relevant scientific literature and consultation with specialists, if necessary. A critical assessment of available diagnostic and therapeutic options, considering their species specificity and potential risks and benefits, is essential. Finally, all decisions must be made within the framework of applicable U.S. federal and state regulations and institutional policies, with a constant awareness of the ethical implications for individual animals, populations, and conservation efforts. Question 9. Market research demonstrates that a novel gastrointestinal parasite has been identified in a captive population of a rare, endangered marsupial. The parasite appears to cause significant morbidity and mortality. A veterinarian is tasked with diagnosing the cause of illness in a severely debilitated individual. considering the unique comparative anatomy of marsupial digestive systems, which diagnostic approach would be most appropriate to investigate the gastrointestinal tract for evidence of this parasite and its effects? Option A. Relying solely on external physical examination and palpation to assess the severity of gastrointestinal distress without invasive procedures. Option B. Conducting a fecal flotation and direct smear examination, assuming the parasite's life cycle and shedding patterns are similar to those of common domestic herbivores. Option C. Performing a diagnostic laparoscopy with targeted biopsies of the small intestine, guided by an understanding of the marsupial's specific intestinal morphology and vascular supply. Option D. Administering a broad-spectrum anthelmintic treatment based on common gastrointestinal parasites found in domestic mammals, without further diagnostic imaging. The correct answer is C. Performing a diagnostic laparoscopy with targeted biopsies of the small intestine, guided by an understanding of the marsupial's specific intestinal morphology and vascular supply. Explanation: this scenario presents a professionally challenging situation because it requires the veterinarian to balance the immediate needs of a critically ill animal with the long-term implications of diagnostic and therapeutic choices, all within the context of zoological medicine and its unique ethical and regulatory landscape. The veterinarian must consider not only the animal's welfare, but also the potential impact on the species' conservation, the institution's mission, and the broader scientific community. Careful judgment is required to select the most appropriate diagnostic approach that is both informative and minimally invasive, considering the species-specific anatomy and physiology, and the potential for stress or injury associated with different procedures. The correct approach represents best professional practice because it prioritizes a thorough, species-specific understanding of anatomy and physiology to guide diagnostic decisions. This aligns with the core principles of zoological medicine, which emphasize the unique biological needs of diverse species. By considering the comparative anatomy of the gastrointestinal tract and the physiological implications of potential disease processes, the veterinarian can select diagnostic tools that are most likely to yield accurate results with the lowest risk. This approach is ethically sound, as it minimizes patient stress and potential harm, and it is professionally responsible, as it leverages specialized knowledge to ensure optimal patient care. Furthermore, it adheres to the ethical guidelines of veterinary practice, which mandate the use of appropriate diagnostic methods and the consideration of species-specific needs. An incorrect approach that relies solely on generalized mammalian anatomy would be professionally unacceptable. This failure stems from a lack of species-specific knowledge, which can lead to misinterpretation of findings, inappropriate diagnostic procedures, and potentially harmful outcomes for the animal. Ethically, this demonstrates a disregard for the unique physiological characteristics of the species, potentially violating the principle of do no harm. Regulatory failure could occur if the chosen diagnostic method, based on generalized knowledge, proves to be ineffective or even detrimental, leading to a breach of standards of care expected for zoological species. Another incorrect approach that prioritizes speed and cost-effectiveness over diagnostic accuracy and animal welfare would also be professionally unacceptable. This approach fails to recognize the inherent value of each individual animal and the ethical imperative to provide the best possible care, regardless of perceived economic constraints. Such a decision would likely violate ethical principles of animal welfare and could be seen as a failure to meet professional standards of care, potentially leading to regulatory scrutiny. The professional decision-making process for similar situations should involve a systematic evaluation of the animal's condition, a comprehensive review of relevant literature on the species' anatomy and physiology, and consultation with specialists if necessary. The veterinarian should consider the potential benefits and risks of each diagnostic and therapeutic option, always prioritizing the animal's welfare and adhering to established ethical and regulatory guidelines. A comparative anatomical and physiological perspective is crucial for understanding species-specific vulnerabilities and tailoring interventions accordingly. Question 10. The efficiency study reveals that the zoological institution's anesthesia monitoring protocols for exotic animals are not consistently meeting established standards, leading to potential patient compromise and increased risk. Considering the DACZM commitment to advanced veterinary care and the ethical obligations to exotic species, Which of the following approaches best addresses this identified deficiency in anesthetic management? Option A. Rely primarily on experienced veterinary technicians to visually assess the animal's respiratory rate, mucous membrane color, and reflexes, with interventions initiated only when the animal exhibits overt signs of distress or instability. Option B. Delay the implementation of advanced monitoring until a specific adverse event occurs, at which point a review of the incident will be conducted to determine if protocol adjustments are necessary. Option C. Implement a mandatory multimodal anesthetic monitoring system that includes continuous capnography, pulse oximetry, and invasive or non-invasive blood pressure monitoring, coupled with a standardized protocol for documenting vital signs and a clear escalation pathway for intervention based on predefined physiological parameters for each species. Option D. Standardize anesthetic protocols across all exotic species to streamline procedures and reduce the need for specialized equipment, focusing on readily available anesthetic agents and common monitoring techniques. The correct answer is C. Implement a mandatory multimodal anesthetic monitoring system that includes continuous capnography, pulse oximetry, and invasive or non-invasive blood pressure monitoring, coupled with a standardized protocol for documenting vital signs and a clear escalation pathway for intervention based on predefined physiological parameters for each species. Explanation. The efficiency study reveals that a zoological institution's anesthesia monitoring protocols for exotic animals are not consistently meeting established standards, leading to potential patient compromise and increased risk. This scenario is professionally challenging because exotic animals present unique physiological challenges, often with limited published data on anesthetic responses and recovery. The inherent variability in species, individual health status, and the complexity of monitoring equipment in a zoological setting demand meticulous attention to detail and a proactive approach to patient safety. Adherence to established veterinary anesthesia guidelines, even when adapted for exotic species, is paramount. The correct approach represents best professional practice because it prioritizes patient welfare through comprehensive, species-specific monitoring and a structured, adaptive management plan. This aligns with the ethical obligations of a veterinarian to provide the highest standard of care, as mandated by Professional Veterinary Practice Acts and the American College of Zoological Medicine's DACZM, Commitment to Excellence in Zoological Medicine. It involves continuous assessment of vital signs, prompt recognition of deviations, and the implementation of corrective actions based on sound physiological principles and available literature, ensuring the animal's safety throughout the anesthetic period and recovery. An incorrect approach that relies solely on visual assessment without objective monitoring data fails to meet the standard of care. This is a regulatory and ethical failure because it neglects the fundamental principles of anesthetic monitoring, which require objective physiological data to detect subtle changes that may precede clinical signs of distress or compromise. Such an approach could violate Veterinary Practice Acts requiring competent care and the DACZM ethical guidelines promoting evidence-based medicine. Another incorrect approach that involves delaying intervention until significant clinical deterioration is observed is also a critical failure. This demonstrates a lack of proactive patient management and a reactive approach to anesthesia, which is unacceptable. Ethically, it breaches the duty of care owed to the patient, and regulatorily, it could be construed as gross negligence under Veterinary Practice Acts, as it fails to anticipate and mitigate anesthetic risks. A third incorrect approach that involves using generic anesthetic protocols without considering species-specific physiology or the animal's individual health status is also professionally unacceptable. This neglects the unique metabolic pathways, cardiovascular responses, and respiratory characteristics of different exotic species. It is a regulatory and ethical failure because it deviates from the principle of providing individualized and appropriate veterinary care, potentially leading to adverse outcomes and contravening the DACZM emphasis on specialized knowledge and application in zoological medicine. The professional decision-making process for similar situations should involve a thorough pre-anesthetic assessment, including a review of species-specific literature and the individual animal's health history. This should be followed by the selection of appropriate anesthetic agents and protocols, the establishment of a comprehensive monitoring plan utilizing both objective data and clinical observation, and the development of a contingency plan for potential complications. Continuous reassessment of the patient's status and prompt, informed intervention are crucial throughout the anesthetic period and recovery. Question 11. The risk matrix shows a moderate likelihood of gastrointestinal obstruction in a newly acquired, adult male reticulated giraffe exhibiting intermittent anorexia and mild abdominal distension, with a high impact on the animal's health and survival. Considering the species-specific physiology and potential for rapid deterioration, which diagnostic and management strategy best aligns with the principles of zoological medicine and animal welfare regulations? Option A. Perform immediate exploratory laparotomy to identify and address any potential obstruction, prioritizing surgical intervention over less invasive diagnostic methods. Option B. Conduct a thorough physical examination, including abdominal palpation and auscultation, followed by diagnostic imaging, e.g., abdominal ultrasound, plain radiographs, and fecal analysis to guide further diagnostic and therapeutic decisions. Option C. Administer a potent gastrointestinal stimulant and laxative to promote passage of any potential ingesta while observing for clinical improvement. Option D. Initiate broad-spectrum antibiotic therapy and supportive care, monitoring for spontaneous resolution over 48 hours before considering further diagnostics. The correct answer is D. Initiate broad-spectrum antibiotic therapy and supportive care, monitoring for spontaneous resolution over 48 hours before considering further diagnostics. Explanation: this scenario presents a professionally challenging situation due to the inherent complexity of diagnosing and managing cardiovascular, respiratory, and digestive system dysfunctions in diverse non-domestic species. The challenge lies in the limited availability of species-specific reference ranges, the potential for subtle clinical signs to indicate significant pathology, and the ethical imperative to provide the highest standard of care while adhering to regulatory guidelines for animal welfare and professional conduct. Careful judgment is required to balance diagnostic thoroughness with the animal's well-being and the practical limitations of the clinical setting. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based diagnostic strategy that aligns with the principles of veterinary medicine and the ethical obligations of a diplomate of the American College of Zoological Medicine. This involves a thorough physical examination, targeted diagnostic imaging, appropriate laboratory analysis, and consideration of species-specific physiology and potential environmental or husbandry factors. This comprehensive approach ensures that all potential causes are investigated, leading to a more accurate diagnosis and effective treatment plan, thereby upholding the commitment to animal health and welfare as mandated by professional standards and ethical guidelines governing zoological medicine. An incorrect approach that relies solely on empirical treatment without a definitive diagnosis fails to meet professional standards. This could lead to inappropriate or ineffective therapies, potentially exacerbating the animal's condition or causing iatrogenic harm. Ethically, this approach neglects the duty to diagnose accurately and treat effectively. Another incorrect approach that involves invasive procedures without sufficient justification or consideration of the animal's stress level violates the principle of minimizing harm and distress. Regulatory failure would occur if such actions contravene guidelines on animal handling, anesthesia, or surgical necessity, potentially leading to animal welfare violations. A third incorrect approach that dismisses subtle clinical signs due to their nonspecificity risks overlooking early-stage disease, which can have severe consequences for the animal's prognosis and survival. This demonstrates a failure in due diligence and a lack of commitment to thorough diagnostic investigation. Professional decision-making in similar situations should involve a structured approach. 1. Comprehensive data gathering, history, physical exam, environmental assessment. 2. Differential diagnosis generation based on species, signalment, and initial findings. 3. Prioritization of diagnostic tests based on likelihood of diagnosis, invasiveness, and animal welfare. 4. Interpretation of results in the context of species-specific knowledge and available literature. 5. Development of a treatment plan with clear objectives and contingency planning. 6. Continuous reassessment and adjustment of the plan based on the animal's response. This systematic process ensures that decisions are informed, ethical, and aligned with the highest standards of zoological medicine. Question 12. Consider a scenario where a zoological institution is tasked with developing a new dietary regimen for a newly acquired group of endangered lemurs. The institution has limited access to specialized primate foods and a history of feeding a commercially available, general-purpose primate chow to other species with perceived success. The veterinary team is aware of recent research suggesting specific micronutrient deficiencies in captive lemurs fed less varied diets. What approach best aligns with U.S. federal regulations governing animal care and welfare and best professional practices for zoological medicine? Option A. Conduct a comprehensive literature review on lemur nutrition. Consult with a board-certified veterinary nutritionist specializing in exotic animals, and develop a custom diet plan incorporating species-specific nutrient requirements, natural foraging behaviors, and available, cost-effective ingredients, with a plan for ongoing monitoring and adjustment. Option B. Rely on anecdotal evidence from other zoological facilities regarding their lemur feeding practices, without formal scientific validation or consultation with specialists. Option C. Continue feeding the general-purpose primate chow that has been used for other species, assuming it provides adequate nutrition for all primates, and only intervene if overt signs of illness appear. Option D. Source the least expensive commercially available primate chow that meets basic caloric requirements, prioritizing cost savings to allocate funds to other animal care needs. The correct answer is A. Conduct a comprehensive literature review on lemur nutrition. Consult with a board-certified veterinary nutritionist specializing in exotic animals, and develop a custom diet plan incorporating species-specific nutrient requirements, natural foraging behaviors, and available, cost-effective ingredients, with a plan for ongoing monitoring and adjustment. Explanation. This scenario presents a common implementation challenge in zoological medicine, translating broad nutritional guidelines into practical, species-specific diets for animals with unique physiological and behavioral needs, while adhering to U.S. federal regulations governing animal care and welfare. The challenge lies in balancing scientific literature, expert opinion, and the practical constraints of sourcing, cost, and palatability, all within the framework of ensuring animal health and preventing disease, which is a core responsibility under the Animal Welfare Act, AWA. The correct approach prioritizes a comprehensive, evidence-based strategy that involves detailed assessment, consultation, and iterative refinement. This aligns with the AWA's mandate for adequate nutrition and veterinary care, which implies a proactive and informed approach to diet formulation. It emphasizes consulting current scientific literature, collaborating with veterinary nutritionists, and considering species-specific requirements, including natural foraging behaviors and potential dietary deficiencies or excesses. This systematic process ensures that the diet is not only nutritionally complete, but also appropriate for the individual animal's health status and the facility's resources, thereby upholding the highest standards of animal welfare and professional responsibility. An incorrect approach that relies solely on anecdotal evidence or historical practices fails to meet the standard of care expected under the AWA. The AWA requires that animals receive a diet that is appropriate for their species, age, and condition, and this necessitates a scientific basis for dietary decisions. Relying on what has always been done, without critical evaluation or incorporating new scientific understanding, is a failure to provide adequate veterinary care and can lead to subclinical or overt nutritional deficiencies or excesses, impacting animal health and welfare. Another incorrect approach that focuses exclusively on cost reduction without a thorough nutritional assessment is also ethically and regulatorily problematic. While fiscal responsibility is important, it cannot supersede the primary obligation to provide adequate nutrition. The AWA implicitly requires that budgetary constraints do not compromise the health and well-being of the animals. A diet that is inexpensive but nutritionally inadequate is a direct violation of the spirit and letter of animal welfare regulations. A third incorrect approach that ignores species-specific behavioral needs, such as foraging or social feeding patterns, also falls short. While not always explicitly detailed in the AWA, the concept of psychological well-being is increasingly recognized as integral to animal welfare. Diets that do not consider natural behaviors can lead to stress, boredom, and abnormal behaviors, which are indicators of compromised welfare and can indirectly impact physical health. Best practices in zoological medicine advocate for enriching environments and providing diets that allow for natural behaviors, which contributes to overall health and reduces the likelihood of stress-related health issues. The professional decision-making process for such situations should begin with a thorough literature review and consultation with experts. This should be followed by a detailed assessment of the specific animal's needs, considering age, health status, reproductive condition, and any known dietary sensitivities. The development of a diet plan should involve collaboration with veterinary nutritionists and consideration of practical aspects like availability and cost, but always with the animal's nutritional and behavioral needs as the paramount concern. Regular monitoring of the animal's health, body condition, and fecal output, along with periodic review and adjustment of the diet based on new scientific information or observed outcomes, is crucial for ensuring optimal welfare. Question 13. The investigation demonstrates a novel, ulcerative lesion on the dorsal aspect of the tongue in a captive reticulated giraffe, Giraffa reticulata. The lesion is firm, raised, and approximately 2 cm in diameter, with mild surrounding erythema. The giraffe is otherwise bright and alert, with no systemic signs of illness. Given the rarity of such lesions in this species and the potential for zoonotic transmission, what is the most appropriate diagnostic approach to definitively characterize the lesion and guide further management? Option A. Submit a full-thickness punch biopsy of the lesion for definitive histopathologic analysis, with results expected in 7-10 business days. Option B. Perform a complete gross examination of the lesion and surrounding tissues, document findings, and monitor the lesion's progression over the next 2 weeks. Option C. Obtain a single fine needle aspirate from the center of the lesion for immediate cytologic evaluation by the on-site veterinarian. Option D. Submit both fine needle aspirates for immediate cytologic evaluation and a full-thickness punch biopsy for histopathologic analysis. The correct answer is D. Submit both fine needle aspirates for immediate cytologic evaluation and a full-thickness punch biopsy for histopathologic analysis. Explanation: Scenario analysis. This scenario is professionally challenging because it involves a rare and potentially zoonotic disease in a zoological collection, requiring a rapid and accurate diagnostic approach to protect both animal and human health. The veterinarian must balance the need for definitive diagnosis with the welfare of the animal and the potential risks to staff and the public. The limited availability of specialized diagnostic services for exotic species adds another layer of complexity, necessitating careful consideration of sample handling and interpretation. Correct approach analysis. The correct approach, which involves submitting both fine needle aspirates, FNA, and biopsy samples for cytology and histopathology respectively, represents best professional practice. This is because it maximizes the diagnostic yield by providing 2 complementary types of tissue evaluation. Cytology offers rapid preliminary results, which can guide immediate management decisions, while histopathology provides a more detailed and definitive diagnosis, including cellular architecture, tissue invasion, and inflammatory patterns, crucial for understanding disease progression and prognosis. This comprehensive approach aligns with the ethical obligation to provide the highest standard of care for zoological animals and adheres to the principles of responsible veterinary practice, which prioritize accurate diagnosis for effective treatment and disease control. While specific DACZM regulations may not dictate sample submission protocols, the overarching ethical framework of veterinary medicine, which the DACZM upholds, mandates thorough diagnostic investigation, incorrect approaches analysis, submitting only FNA samples for cytology while providing rapid results is an incomplete diagnostic strategy. It may miss subtle architectural changes or invasive characteristics that are only apparent with histopathology, potentially leading to an underdiagnosis or misdiagnosis. This failure to pursue a definitive diagnosis could violate the ethical imperative to provide optimal patient care and could have implications for disease management within the zoological collection. Submitting only a biopsy sample for histopathology without concurrent cytology delays the diagnostic process. While histopathology is definitive, the time required for processing and interpretation means that critical initial management decisions might be postponed, potentially compromising the animal's welfare or increasing the risk of disease transmission. This delay could be seen as a failure to act with due diligence in a situation with potential public health implications. Choosing to rely solely on gross examination and clinical signs without submitting samples for definitive cytologic or histopathologic evaluation is a significant professional and ethical failure. Gross findings can be misleading, and clinical signs alone are often insufficient for a definitive diagnosis, especially in novel or rare diseases. This approach risks misdiagnosis, delayed or inappropriate treatment, and failure to identify a potentially zoonotic agent, thereby jeopardizing animal health, human health, and public safety. It falls short of the expected standard of care for a diplomate-level veterinarian. Professional reasoning. When faced with an unusual lesion in a zoological species, a veterinarian should employ a systematic approach. First, a thorough clinical assessment including detailed history and physical examination is essential. Next, consider the potential differential diagnoses, taking into account the species, environment, and any known disease risks. For lesions, a tiered diagnostic approach is often best. This typically involves obtaining samples for both rapid cytology and definitive histopathology evaluation. The choice of sampling method FNA, punch biopsy, excisional biopsy, should be based on the lesion size, location, and the suspected pathology. Careful sample handling, preservation, and submission to a reputable diagnostic laboratory are paramount. Communication with the pathologist regarding the clinical history and differential diagnoses will enhance the accuracy of their interpretation. This comprehensive and stepwise approach ensures the most accurate diagnosis, facilitates appropriate treatment, and fulfills the veterinarian's ethical and professional responsibilities. Question 14. Upon reviewing a case involving a rescued North American river otter exhibiting signs of lethargy and gastrointestinal distress, which of the following approaches best aligns with the definition and scope of zoological medicine within the United States regulatory framework? Option A. Prioritize a comprehensive assessment of the otter's species-specific physiology, common zoonotic disease risks associated with wild mammals in its native habitat, and relevant federal and state regulations governing the rehabilitation and care of native wildlife, consulting the Animal Welfare Act and state wildlife agency guidelines. Option B. Proceed with treatment based on personal experience with other semi-aquatic mammals, without specific research into river otter diseases or relevant legal statutes. Option C. Administer broad-spectrum antibiotics and supportive care, without investigating the specific environmental factors or potential legal implications of possessing and treating a wild animal. Option D. Focus treatment strategies on common gastrointestinal parasites and bacterial infections typically seen in domestic dogs and cats, assuming similar etiologies and therapeutic responses. The correct answer is A. Prioritize a comprehensive assessment of the otter's species-specific physiology, common zoonotic disease risks associated with wild mammals in its native habitat, and relevant federal and state regulations governing the rehabilitation and care of native wildlife, consulting the Animal Welfare Act and state wildlife agency guidelines. Explanation. This scenario is professionally challenging because it requires the veterinarian to navigate the complex interplay between the definition and scope of zoological medicine, which encompasses a broad range of species and environments, and the specific regulatory framework governing the practice of veterinary medicine in the United States, as overseen by bodies like the American Veterinary Medical Association (AVMA) and state veterinary boards. The veterinarian must consider not only the biological and medical aspects of the animals, but also the legal and ethical obligations associated with their care, particularly when dealing with species that may have unique legal statuses or conservation concerns. Careful judgment is required to ensure that all actions taken are within the established legal and ethical boundaries of zoological medicine practice. The correct approach represents best professional practice because it directly addresses the core of zoological medicine by considering the broad scope of species and their unique needs, while simultaneously adhering to the established regulatory framework of the United States. This includes understanding the legal definitions of veterinary practice, species-specific regulations, e.g., Endangered Species Act, Animal Welfare Act, and the ethical guidelines set forth by professional organizations. By prioritizing a comprehensive understanding of both the biological and regulatory landscape, the veterinarian ensures that their actions are legally sound, ethically defensible, and in the best interest of the animals and public health. An incorrect approach that focuses solely on common domestic animal diseases fails to acknowledge the expansive scope of zoological medicine, which inherently includes a vast array of non-domesticated species with distinct physiological, pathological, and environmental considerations. This oversight represents a failure to meet the fundamental definition of zoological medicine and could lead to misdiagnosis, inappropriate treatment, and potential legal ramifications for practicing outside one's expertise or the scope of zoological medicine as defined by regulatory bodies. Another incorrect approach that disregards established federal and state regulations concerning wildlife or exotic animal care would be a significant ethical and regulatory failure. Such an approach could lead to violations of laws designed to protect endangered species, prevent the spread of zoonotic diseases, or ensure humane treatment, resulting in penalties, loss of license, and harm to the animals and public. A third incorrect approach that relies solely on anecdotal evidence or personal experience without consulting current scientific literature or regulatory guidelines demonstrates a lack of due diligence. While experience is valuable, it must be grounded in evidence-based practice and legal compliance. Failure to do so can result in suboptimal patient care and potential legal challenges for practicing below the standard of care expected within zoological medicine. The professional decision-making process for similar situations should involve a systematic risk assessment. This begins with clearly defining the problem and identifying the species involved. Next, the veterinarian must thoroughly research the relevant scientific literature and consult with specialists if necessary. Crucially, they must identify and understand all applicable federal, state, and local regulations pertaining to the species and the practice setting. Ethical considerations, including animal welfare and public safety, must be integrated throughout the process. Finally, the veterinarian should document their decision-making process and the rationale for their chosen course of action, ensuring transparency and accountability. Question 15. Benchmark analysis indicates that a veterinarian is presented with a captive-born emerald tree boa, Corellus caninus, exhibiting lethargy and decreased appetite. The available hematology and blood chemistry results show several values outside the typical reference ranges for domestic cats. Considering the limited species-specific reference ranges for many reptile species, which of the following diagnostic approaches would be most appropriate for interpreting these findings and guiding further patient management? Option A. Extrapolate findings directly from domestic cat reference ranges, assuming that basic physiological processes are sufficiently similar to guide diagnosis and treatment for this reptile. Option B. Disregard the blood work entirely due to the lack of definitive species-specific reference ranges and rely solely on the physical examination and anecdotal observations. Option C. Prioritize consulting peer-reviewed literature and specialized databases for established emerald tree boa or closely related boyd snake hematology and blood chemistry reference ranges, and interpret the results in the context of the snake's clinical signs, physical examination, and husbandry. Option D. Assume that the deviations from domestic cat reference ranges indicate significant pathology and proceed with broad-spectrum antimicrobial therapy and aggressive fluid resuscitation. The correct answer is C. Prioritize consulting peer-reviewed literature and specialized databases for established emerald tree boa or closely related boyd snake hematology and blood chemistry reference ranges, and interpret the results in the context of the snake's clinical signs, physical examination, and husbandry. Explanation. This scenario presents a professional challenge due to the inherent variability in hematological and blood chemistry parameters across a wide range of exotic animal species, coupled with the limited availability of species-specific reference ranges. The veterinarian must exercise careful judgment to interpret findings accurately, recognizing that deviations from what might be considered normal in more common domestic species could be entirely physiological in an exotic animal. This requires a deep understanding of comparative physiology and a commitment to evidence-based medicine, relying on the best available literature and expert consultation when necessary. The correct approach represents best professional practice because it prioritizes the acquisition and application of species-specific data. This aligns with the ethical obligation to provide competent care and avoid harm, as mandated by veterinary practice acts and professional codes of conduct. Utilizing peer-reviewed literature, consulting with specialists, and considering the animal's clinical presentation and husbandry are all critical components of a thorough diagnostic workup. This approach minimizes the risk of misdiagnosis and inappropriate treatment, ensuring the welfare of the exotic animal. An incorrect approach that relies solely on domestic animal reference ranges fails to acknowledge the significant physiological differences between species. This can lead to misinterpretation of results, potentially resulting in unnecessary diagnostic procedures or treatments, or conversely, overlooking critical abnormalities. Ethically, this constitutes a failure to provide competent care and could be considered negligence. Another incorrect approach that ignores the clinical context and husbandry factors is equally problematic. Bloodwork results must always be interpreted in conjunction with the animal's history, physical examination findings, and environmental conditions. A deviation in a blood parameter might be explained by stress from handling, diet, or environmental factors, rather than underlying disease process. Failing to consider these elements can lead to diagnostic errors and suboptimal patient outcomes, violating the principle of providing individualized care. A further incorrect approach that involves extrapolating data from distantly related species without critical evaluation is also professionally unacceptable. While comparative data can be a starting point, significant physiological differences can exist even between closely related species. Making broad assumptions without a solid scientific basis risks misinterpretation and can lead to incorrect diagnoses and treatments, contravening the principles of responsible veterinary practice. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly gather patient history, including species, age, sex, diet, husbandry, and presenting complaints. 2. Conduct a comprehensive physical examination. 3. Prioritize obtaining species-specific reference ranges from reputable sources, peer-reviewed literature, specialized databases. 4. If species-specific ranges are unavailable, cautiously consider data from closely related species, acknowledging the limitations. 5. Interpret hematology and blood chemistry results in conjunction with the clinical presentation, physical findings, and husbandry. 6. Consult with specialists or experienced colleagues when faced with ambiguous or challenging cases. 7. Document all findings, interpretations, and treatment decisions meticulously. Question 16. Examination of the data shows a free-ranging adult bobcat, Lynx rufus, presenting with a deep, penetrating abdominal wound suspected to involve visceral perforation. Given the limited published literature on surgical interventions for this specific injury in this species, which of the following approaches best reflects current zoological medicine best practices and ethical considerations for wildlife surgery? Option A. Apply surgical techniques commonly used for domestic cats, assuming significant anatomical overlap and without extensive species-specific anatomical review. Option B. Proceed with a surgical exploration and repair, adapting standard canine abdominal surgical techniques by carefully considering the bobcat's known comparative abdominal anatomy, utilizing minimally invasive approaches where feasible, and preparing for species-specific anatomical variations. Option C. Elect to euthanize the animal immediately due to the high perceived risk and lack of definitive surgical protocols, prioritizing the avoidance of potential surgical complications. Option D. Attempt surgical repair based on a single, unverified online forum post describing a similar procedure in a different wild felid species. The correct answer is B. Proceed with a surgical exploration and repair, adapting standard canine abdominal surgical techniques by carefully considering the bobcat's known comparative abdominal anatomy, utilizing minimally invasive approaches where feasible, and preparing for species-specific anatomical variations. Explanation. This scenario presents a professionally challenging situation due to the inherent variability in wildlife anatomy and the limited availability of established surgical protocols compared to domestic species. The veterinarian must rely on a strong foundation of comparative surgical anatomy, adapt techniques based on species-specific considerations, and prioritize patient welfare and conservation ethics. Careful judgment is required to balance the need for intervention with the potential risks of surgery in a wild animal, especially when dealing with novel or poorly documented conditions. The correct approach represents best professional practice, because it prioritizes a thorough understanding of the specific wildlife species' anatomy and physiology, coupled with a conservative and adaptable surgical strategy. This aligns with the ethical obligations of a zoological medicine practitioner to minimize harm, maximize the chances of successful recovery, and consider the long-term implications for the individual and its species. Adherence to established veterinary principles, even in the absence of species-specific guidelines, ensures that decisions are evidence-based and patient-centered. An incorrect approach involving the direct application of domestic animal surgical techniques without significant modification would be ethically and professionally unacceptable. This failure stems from a disregard for species-specific anatomical differences, which could lead to iatrogenic injury, increased morbidity, and a higher risk of surgical failure. Such an approach would violate the principle of do no harm and could be considered a breach of professional competence, potentially leading to disciplinary action under veterinary practice acts that mandate appropriate care based on species. Another incorrect approach, relying solely on anecdotal evidence or unverified reports from other practitioners without critical evaluation, poses significant risks. A collegial consultation is valuable. Basing critical surgical decisions on unsubstantiated information can lead to suboptimal outcomes and potential harm. This approach lacks the rigor of evidence-based medicine and could be viewed as unprofessional if it leads to patient compromise. The professional decision-making process for similar situations should involve a systematic evaluation. First, comprehensive assessment of the patient's condition and the specific wildlife species' known anatomy and physiology. Second, a thorough literature review for any relevant published data on surgical approaches in similar species or for the specific condition. Third, consultation with experienced colleagues or specialists in wildlife surgery. Fourth, a careful risk-benefit analysis, considering the potential for success, the risks of intervention versus non-intervention, and the animal's welfare and conservation status. Finally, the development of a tailored surgical plan that incorporates adaptability and contingency measures, with a strong emphasis on minimizing invasiveness and maximizing the potential for a successful return to the wild, if applicable. Question 17. Performance analysis shows that a critically ill, non-ambulatory rhinoceros is exhibiting signs of acute abdominal distress, but is too unstable for safe transport to the radiology suite or for prolonged manual restraint required for conventional radiography. Which diagnostic imaging approach represents the most appropriate initial step to rapidly assess the abdominal cavity while minimizing patient risk and stress, adhering to the ethical and professional standards of zoological medicine? Option A. Delay all diagnostic imaging until the animal is fully stabilized, which may take several hours. Option B. Proceed with full-body conventional radiography, sedating the animal as necessary for positioning. Option C. Administer general anesthesia to facilitate computed tomography (CT) of the abdomen. Option D. Utilize portable ultrasound for immediate bedside assessment of abdominal organs and fluid accumulation. The correct answer is D. Utilize portable ultrasound for immediate bedside assessment of abdominal organs and fluid accumulation. Explanation. Scenario analysis. This scenario presents a common challenge in zoological medicine: the need to obtain diagnostic information for a critically ill animal where restraint for conventional radiography is risky. The professional challenge lies in balancing the urgency of diagnosis with the welfare and safety of a compromised patient and the veterinary team. The decision-making process must consider the limitations of each imaging modality in the context of the animal's condition and the available resources, all while adhering to the highest standards of animal care and professional conduct as dictated by the American College of Zoological Medicine (DACZM), ethical guidelines, and relevant U.S. federal and state animal welfare regulations. Correct approach analysis. Utilizing portable ultrasound for initial assessment is the best professional practice in this situation. This approach aligns with DACZM principles of minimizing stress and risk to compromised animals. Ultrasound is non-invasive, does not require general anesthesia or heavy sedation in most cases, and can be performed at the animal's enclosure, significantly reducing transport-related stress and anesthetic risk. It provides real-time imaging of soft tissues and fluid, which is crucial for rapidly identifying life-threatening conditions such as effusions, organ damage, or masses. This aligns with the ethical imperative to provide the best possible care while minimizing harm, a core tenet of veterinary practice and DACZM standards. Furthermore, it respects the principles of responsible use of diagnostic tools, prioritizing less invasive methods when appropriate. Incorrect approaches analysis. Performing full-body conventional radiography without considering the patient's stability is professionally unacceptable. This approach disregards the significant risks associated with moving and potentially sedating a critically ill animal, which could exacerbate its condition or lead to complications. It fails to adhere to the DACZM emphasis on animal welfare and minimizing iatrogenic harm. Ethically, it prioritizes diagnostic information over patient safety, a direct contravention of best practices. Administering general anesthesia for computed tomography, CT, without a thorough pre-anesthetic assessment and stabilization is also professionally unsound. While CT offers superior detail, the risks of anesthesia in a compromised patient are substantial. This approach neglects the critical step of evaluating the patient's physiological status and the potential for anesthetic complications, which is a fundamental aspect of responsible veterinary practice and DACZM ethical guidelines. It also overlooks the potential for less invasive alternatives to achieve a preliminary diagnosis, delaying any diagnostic imaging until the animal is fully stabilized, even if it means waiting for a more opportune time for radiography or CT, is also problematic. While stabilization is important, critically ill animals often require rapid diagnosis to guide immediate therapeutic interventions. Prolonged delay in obtaining diagnostic information can lead to irreversible deterioration of the patient's condition, thereby compromising the overall outcome and failing to meet the standard of care expected by the DACZM. This approach prioritizes a potentially unattainable ideal over timely, albeit potentially riskier, diagnostic efforts. Professional reasoning. Professionals facing such a dilemma should employ a systematic approach. 1. Patient assessment. Thoroughly evaluate the animal's current physiological status, including vital signs, hydration, and any obvious signs of pain or distress. 2. Risk-benefit analysis. Weigh the potential diagnostic benefits of each imaging modality against the inherent risks to the patient, considering its current condition. 3. Modality selection. Prioritize less invasive and less stressful diagnostic techniques that can provide critical information quickly. Portable ultrasound is often the first choice in unstable patients. 4. Resource availability. Consider the availability of equipment and trained personnel for each imaging technique. 5. Team communication. Discuss the risks and benefits with the veterinary team and any relevant stakeholders to ensure a consensus on the best course of action. 6. Documentation. Meticulously document the patient's condition, the rationale for the chosen diagnostic approach, and any risks discussed. Question 18. System analysis indicates that a zoological institution is considering acquiring several new species for its collection. The veterinarian responsible for the collection must develop a comprehensive plan that addresses the health, welfare, and legal compliance associated with this acquisition. Which of the following approaches best represents a responsible and legally sound strategy for managing this zoological medicine overview? Option A. Prioritize acquiring species that are readily available and less expensive to maintain, deferring detailed health assessments and specialized veterinary consultations until after the animals have been integrated into the existing collection. Option B. Proceed with the acquisition based on the perceived aesthetic appeal of the species and the availability of suitable enclosure space, assuming that common veterinary practices will suffice for their care. Option C. Rely on informal advice from other zoological facilities and online forums to determine the necessary quarantine procedures and veterinary care, focusing primarily on immediate enclosure setup rather than comprehensive health evaluations. Option D. Implement a rigorous quarantine and diagnostic screening protocol for all incoming animals. Conduct thorough literature reviews on species-specific husbandry and health requirements, and consult with external zoological medicine specialists to ensure appropriate veterinary care and biosecurity measures are in place, while verifying compliance with the Animal Welfare Act and any relevant state or local regulations. The correct answer is D. Implement a rigorous quarantine and diagnostic screening protocol for all incoming animals. Conduct thorough literature reviews on species-specific husbandry and health requirements, and consult with external zoological medicine specialists to ensure appropriate veterinary care and biosecurity measures are in place, while verifying compliance with the Animal Welfare Act and any relevant state or local regulations. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinarian to balance the immediate welfare needs of a diverse group of zoological animals with the long-term sustainability of the zoological institution's collection and its compliance with federal regulations. The veterinarian must consider species-specific needs, potential zoonotic disease transmission, and the legal implications of animal acquisition and disposition. The complexity arises from the interconnectedness of these factors and the potential for cascading negative consequences if decisions are not carefully considered and ethically grounded. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based, and legally compliant strategy. This involves thorough veterinary assessment, consultation with relevant experts, and adherence to established protocols for animal health and biosecurity. Specifically, it aligns with the principles of responsible animal management and the ethical obligations of zoological institutions as outlined by organizations like the American Association of Zoos and Aquariums (AZA), and relevant federal regulations such as the Animal Welfare Act (OWA) and the Captive Wildlife Safety Act (CWSA). This approach ensures that decisions are made with the best interests of the animals, the public, and the institution in mind, while minimizing legal and ethical risks. Incorrect approaches analysis. An approach that focuses solely on the immediate perceived needs of a single species without considering the broader implications for the collection or regulatory compliance is professionally unacceptable. This could lead to the introduction of disease into the existing collection, violate AWA requirements for proper housing and care, or contravene CWSA regulations regarding the possession of certain species. An approach that prioritizes cost-saving measures over essential veterinary care or biosecurity protocols is also professionally unacceptable. This directly violates ethical obligations to provide adequate care and can lead to significant animal suffering, disease outbreaks, and potential legal penalties under the AWA for failure to meet minimum standards. An approach that relies on anecdotal information or personal preference rather than scientific evidence and expert consultation is professionally unsound. This can result in suboptimal or harmful management decisions, compromise animal welfare, and expose the institution to regulatory scrutiny for failing to adhere to best practices in zoological medicine. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough assessment of the situation, including the health status of individual animals, the overall health of the collection, and the relevant legal and ethical frameworks. This should be followed by consultation with colleagues, specialists, and relevant regulatory bodies. Evidence-based decision-making, prioritizing animal welfare, and ensuring compliance with all applicable laws and guidelines are paramount. A proactive approach to biosecurity and disease prevention, coupled with a commitment to continuous learning and adaptation, forms the foundation of sound professional judgment in zoological medicine. Question 19. Analysis of anesthetic protocol selection for a routine diagnostic procedure in a captive Andean condor, Vultur gryphus, versus a routine diagnostic procedure in a captive black rhinoceros, Diceros bicornis. Considering the significant physiological and anatomical differences between these species and the DACZM emphasis on species-specific anesthetic management, which of the following represents the most ethically and professionally sound approach to developing anesthetic protocols for these distinct zoological species? Option A. Prioritize developing a highly individualized anesthetic protocol for each species, drawing upon peer-reviewed literature specific to avian and large mammal anesthesia, consulting with specialists in avian and large mammal anesthesia, respectively, and incorporating species-appropriate monitoring and supportive care measures. Option B. Develop a single, generalized anesthetic protocol that is a composite of common protocols used for large birds and large mammals, adjusting dosages based on estimated body weight, and administer it to both species. Option C. Utilize a protocol primarily derived from domestic dog anesthesia, as it is a well-understood species, and adapt it based on the veterinarian's subjective assessment of the condor and rhinoceros's condition during induction. Option D. Select anesthetic agents based on their availability in the clinic, prioritizing those that are most cost-effective, and administer them at dosages commonly used for common zoo carnivores, assuming a degree of physiological similarity. The correct answer is B. Develop a single, generalized anesthetic protocol that is a composite of common protocols used for large birds and large mammals, adjusting dosages based on estimated body weight, and administer it to both species. Explanation: this scenario presents a professional challenge due to the inherent variability in anesthetic responses across diverse zoological species, coupled with the critical need to adhere to established veterinary ethical standards and the specific guidelines of the American College of Zoological Medicine, DACZM, regarding species-appropriate care and drug use. The veterinarian must balance the immediate need for safe and effective anesthesia with long-term patient well-being and the responsible use of controlled substances. The DACZM emphasis on evidence-based practice and species-specific knowledge is paramount. The correct approach represents best professional practice because it prioritizes a thorough, species-specific risk assessment and protocol development based on the best available scientific literature and expert consensus, aligning with DACZM commitment to advancing zoological medicine through rigorous scientific inquiry and application. This includes considering the unique physiology, potential comorbidities, and environmental factors of the target species, and selecting anesthetic agents and dosages that have demonstrated safety and efficacy in that species or closely related taxa. Furthermore, it involves meticulous monitoring and the availability of appropriate reversal agents, reflecting a proactive and comprehensive approach to patient safety. An incorrect approach that relies solely on extrapolation from domestic animal protocols, without critical evaluation for zoological species, fails to meet DACZM standards. This represents a regulatory and ethical failure by potentially exposing the animal to undue risk due to physiological differences, leading to adverse outcomes and violating the principle of providing species-appropriate care. Another incorrect approach that disregards the need for specialized monitoring equipment or reversal agents for exotic species is also ethically unacceptable. This demonstrates a lack of preparedness and a failure to uphold the highest standards of patient care, potentially leading to irreversible harm or death, and contravening the DACZM mandate for excellence in zoological medicine. A third incorrect approach that involves using unapproved or off-label drugs without a strong scientific rationale or documented justification for their necessity in a specific zoological context would also be a significant ethical and professional failing, potentially leading to unpredictable and dangerous outcomes. Professional decision-making in such situations requires a systematic approach. First, conduct an exhaustive literature review for the specific species or closely related taxa. Second, consult with experienced zoological veterinarians and specialists. Third, develop a tailored anesthetic plan that includes pre-anesthetic assessment, drug selection, dosage calculations based on species-specific pharmacokinetics and pharmacodynamics, appropriate monitoring parameters, and contingency plans for complications. Finally, document the entire process meticulously, including rationale for drug choices and any deviations from standard protocols. Question 20. Risk assessment procedures indicate that a long-standing practice of housing a particular species of exotic bird in individual, barren enclosures, which was considered standard in zoological institutions during the mid-20th century, is now being questioned by a new generation of zoological veterinarians and animal welfare scientists due to concerns about behavioral deprivation and psychological well-being. The current head veterinarian, who trained and practiced during the era when this housing method was prevalent, is hesitant to change the established protocol, citing its historical acceptance and the lack of immediate observable distress in the birds. A junior veterinarian, influenced by recent advancements in avian ethology and enrichment strategies, believes the practice is now ethically indefensible and detrimental to the bird's welfare. What is the most ethically and professionally sound approach for the junior veterinarian to take in addressing the situation, considering the historical context and current scientific understanding? Option A. Present a comprehensive proposal to the head veterinarian and institutional animal care committee, detailing current scientific literature on avian behavioral needs, evidence-based enrichment strategies, and the potential long-term welfare benefits of revised housing, while acknowledging the historical context of the previous practice. Option B. Accept the head veterinarian's perspective, assuming that practices accepted in the past are inherently valid and do not require reevaluation in light of evolving scientific knowledge. Option C. Advocate for the immediate dismantling of all existing enclosures and the implementation of new housing without any prior consultation or planning, emphasizing the urgency of the situation. Option D. Immediately initiate a public campaign or report the perceived welfare issue to external regulatory bodies, without first attempting to resolve the matter internally through established institutional channels. The correct answer is A. Present a comprehensive proposal to the head veterinarian and institutional animal care committee, detailing current scientific literature on avian behavioral needs, evidence-based enrichment strategies, and the potential long-term welfare benefits of revised housing, while acknowledging the historical context of the previous practice. Explanation. The scenario presents a professional challenge rooted in the historical development of zoological medicine and its ethical implications. The veterinarian is faced with a situation where a long-standing, but now ethically questionable, practice is being questioned due to advancements in animal welfare science and evolving professional standards. The challenge lies in balancing the legacy of past practices with current ethical obligations and scientific understanding, particularly when those past practices were considered standard of care at the time of their inception. Careful judgment is required to navigate this tension without compromising animal welfare or professional integrity. The correct approach represents best professional practice because it prioritizes current scientific understanding and ethical guidelines for animal welfare. It acknowledges the historical context, but firmly grounds the decision-making in contemporary knowledge and ethical frameworks. This aligns with the core principles of veterinary medicine, which emphasize the well-being of animals and the responsibility of practitioners to stay abreast of advancements. Adhering to current best practices, even if they diverge from historical norms, is a regulatory and ethical imperative for maintaining professional competence and public trust. An incorrect approach that relies solely on historical precedent without critical evaluation fails to meet current professional standards. This represents an ethical failure by neglecting the evolution of animal welfare science and potentially perpetuating outdated or harmful practices. It also demonstrates a lack of commitment to continuous learning and adaptation, which is a cornerstone of professional development. Another incorrect approach that dismisses the historical context entirely without considering the potential impact on the institution or the animals might be seen as overly rigid and lacking in nuanced understanding of how practices evolve. This could lead to unnecessary disruption or conflict. A third incorrect approach that prioritizes expediency over ethical consideration or scientific evidence would be a clear violation of professional duty and could have serious welfare consequences. The professional decision-making process in such situations should involve a thorough review of current scientific literature and ethical guidelines pertaining to the specific species and practice in question. It requires consultation with colleagues, specialists, and relevant professional organizations to gain diverse perspectives. A critical evaluation of the historical practice, understanding its origins and rationale, is important, but it should not supersede current evidence-based approaches. The veterinarian must then advocate for the adoption of practices that align with the highest standards of animal welfare and ethical conduct, while also considering the practicalities of implementation within the zoological institution.